of Britain. And then we've Olayinka. She's assistant professor in UCD, where she teaches aging and health, and she also is the president of the Association of Nigerian Nurses in Ireland and executive director of the Federation of African Nurses and Midwives in Ireland. She's also a published author, and her book is outside if you want to buy it, called New, Not a Novice Nurse, a guide for internationally educated nurses to thrive abroad. So Steve, over to you.
3,200 roughly new registrants who are internationally educated nurses.
4,000.
How much? 4,000, so it's gone up, compared to about 1,500 going up in terms of graduates from the Irish programmes. So that it is an issue that we need to deal with in terms of that whole issue around support. So I'm interested in terms of Olayinka, who has written a book, again, plug it again, which is New, Not a Novice Nurse. So I want to ask you two questions. One about what's the key message in terms of New, Not a Novice Nurse, because this is a guide for internationally educated nurses. And then the second question is just in terms of your work at the moment, in terms of developing a plan, in terms of combating racism, in terms of integrating in terms of nurse education.
Okay, thank you so much. Thank you. To start with, I just want to say, we look to your left, to your right, to your front and your back. How many people of color, nurses of color, can you see in this room? And that's one of the questions I ask myself every time I walk into a room like this. I ask the question, why are they not here? And could it be that they don't have time off, or they're just not interested? And I've been in this situation over a long time, and that inspired my book, like supporting internationally educated nurses. There's a lot of issues, so my book is centered on helping them, empowering, when it comes to leadership, because one of the challenges that we have found, and in my role as the president, whatever it is called, all this title, I've heard a lot of complaint of people feeling undervalued due to, I see it as due to racial discrimination, because let's call it what it is, right? Marginalization is a lot of factors, but when it has to do with your skin color or your race, then it is racism. So I felt like that we need support, international educated nurses. And the book is not just for international educated nurses, it's also for the nurse managers, because you need to understand the stories, the experiences, what these nurses go through. So I have my experience and the experiences of other international educated nurses as well, both in the clinicals and in the academia. Talk about language proficiency, communication issues, lack of support, and a lot of other issues as well in the book. I touched on mentorship as well, the role of mentorship and empowerment. So I run my work with racism. So I currently work in UCD, and the thing is there's a lot of problems, but who is finding the solution? What are we doing about it? So I don't want to be talking about problems, because every day, I get nothing less than 5 messages or emails from nurses about a complaint, an issue, so to say, and it overwhelms me. So what is the solution? Luckily, the government announces a funding call to address racism in Ireland. So I felt this is a great opportunity. Can we then develop an anti-racism program, in nursing specifically? So I'm working with some colleagues in UCD, and we also hope to partner with INMO, NMBI to make this possible. So it's co-creating anti-racism educational interventions in nursing practice in Ireland. And I say nothing like that has been done before. In actual fact, there hasn't been any research done when it comes to assessing, even need assessment of these discriminatory practices that exist within our profession. I'm always looking at supporting as well the Irish nurses, the host nurses, because there's this saying that you can't give what you don't have. So from the place of understanding cultural awareness, cultural humility, integration, and I also say it more like intercultural integration, because I need to learn your culture, you need to learn my culture for us to work together. And I think that's the basis of the study. So hopefully, if we get a funding, with or without that, and with your help as well, if you see any funding call, please send it my way. We will be able to do the study and provide like a policy, so to say, that would be a guide to addressing racism in Ireland and nursing. Thank you.
Great, thank you. you, Olayinka, and just to say the INMO are fully supportive of the campaign in relationship to fighting racism, particularly reflecting in terms of our population, so we stand in terms of on the side of fighting racism. Just one other thing to highlight, and I noticed throughout the day there was a number of references in terms of inclusion health as part of nurse education. And you may already be aware of this, but as part of the expert review, nurse education is currently, the curriculum is currently being reviewed in detail. And there will be substantial changes made over the coming months, over the coming year, and it's likely that it will be implemented probably 2026. So if you have anything that you're passionate about, advocate to the NMBI. The INMO will also advocate as well. We've already made a submission, and a major part of our submission was advocating in relationship to inclusion health and in relationship to marginalisation and racism as well. So it's just to highlight that. One of the things that I picked up, you mentioned the importance of mentoring and also supports, Mary mentioned.